foods and drinks to avoid when you have a severe cough. Let's explore the common belief that certain foods and drinks should be avoided when suffering from a severe cough. Focusing specifically on the avoidance of strong-tasting or melansa foods like fish and chicken. While there's no definitive scientific consensus on this, the traditional advice often stems from several factors. 1. Potential for throat irritation. When you have a severe cough, your throat is already inflamed and irritated. Strong-tasting foods, particularly those that are spicy, acidic, or have a strong aroma, can further irritate the throat lining. This can lead to increased discomfort and potentially prolong the cough. Fish and chicken, especially if improperly cooked or overly seasoned, can fall into this category for some individuals. The melansa smell and taste might be particularly irritating to a sensitive throat. 2. Difficulty in swallowing. A severe cough often accompanies a sore throat, making swallowing difficult. Tougher or drier meats, like some preparations of chicken or fish, can exacerbate this difficulty, leading to further irritation. 3. Digestive issues. Some individuals experience digestive discomfort when suffering from a cough. Rich or fatty foods, including certain preparations of chicken and fish, can strain the digestive system, potentially leading to nausea or indigestion, which can indirectly affect the cough. 4. Individual sensitivities and allergies. It's crucial to remember that individual tolerances and sensitivities vary greatly. What might be perfectly fine for one person could trigger a reaction in another. Some individuals might have undiagnosed allergies or sensitivities to certain types of fish or chicken, which could worsen their cough symptoms. 5. The role of traditional beliefs. The avoidance of certain foods during illness often stems from long-standing cultural practices and traditional medicine. While these practices aren't always backed by rigorous scientific evidence, they reflect a cautious approach to nutrition during periods of illness. In summary, the avoidance of melansa foods like certain types of fish and chicken during a severe cough is not based on a single, universally accepted scientific principle. Potential throat irritation, swallowing difficulties, individual sensitivities, and long-standing cultural practices. The best course of action is to listen to your body. Worsen your cough or cause discomfort, it's best to avoid it. Consult a doctor for proper diagnosis and treatment of your cough. They can help determine the underlying cause and recommend appropriate remedies. The belief that eating ice cream and drinking cold beverages helps alleviate a severe cough is a common one, but it's crucial to understand that this is largely a misconception, and the effect is likely more about temporary comfort than actual treatment. While the coolness might provide a fleeting sense of relief, it doesn't address the underlying cause of the cough. Let's break down why this belief persists and why it's not a scientifically sound approach to cough treatment. 1. Temporary numbness and reduced inflammation. The cold temperature of ice cream and cold drinks can temporarily numb the throat and reduce inflammation. This numbing effect can temporarily lessen the sensation of a sore throat, which often accompanies a cough. However, this is merely a masking of the symptom, not a cure for the underlying condition causing the cough. The inflammation will likely return once the numbing effect wears off. 2. Psychological comfort. The act of consuming something cold and soothing can provide a psychological sense of comfort and relief. This placebo effect can be significant, leading individuals to believe the cold food or drink is actively helping their cough. 3. Misunderstanding of causation. Many people associate a cough with a feeling of dryness or irritation in the throat. They may logically assume that something cold will counteract this dryness. However, the underlying cause of the cough is often much more complex, involving infections, allergies, or other medical conditions. Addressing the root cause, not just the symptoms, is essential for effective treatment. 4. Potential for worsening symptoms. For some individuals, consuming very cold foods or drinks can actually worsen their cough. The sudden temperature change in the throat can trigger further irritation and increase mucus production, leading to more coughing. 5. Lack of scientific evidence. There is no robust scientific evidence to support the claim that ice cream or cold drinks effectively treat or cure coughs. While the temporary numbing effect might provide some short-term comfort, it doesn't address the underlying cause of the cough. What to do instead? Instead of relying on ice cream and cold drinks, consider these approaches for managing a severe cough. Consult a doctor. This is the most important step. A doctor can diagnose the underlying cause of your cough and recommend appropriate treatment, which might include medication, rest, or other therapies. Rest. Adequate rest allows your body to fight off infection and recover. Hydration. Drinking plenty of fluids, such as warm water, tea, or broth, helps thin mucus and soothe the throat. Humidifier. Using a humidifier can add moisture to the air, reducing throat irritation. Over-the-counter medications. Over-the-counter cough suppressants or expectorants can help manage symptoms, but always follow the instructions carefully. While ice cream and cold drinks might offer temporary comfort to a sore throat associated with a cough, they do not treat the underlying cause. Relying on these alone is not a sound strategy. Seeking professional medical advice and following a doctor's recommendations are crucial for effective cough management and recovery. The claim that consuming citrus fruits like calamansi and lemon, unmixed with anything else, worsens a severe cough is a common belief, but the reality is more nuanced. While it's not universally harmful, there are reasons why some individuals might find that citrus fruits aggravate their cough symptoms, while others experience no negative effects. Let's examine the potential impacts. 1. Acidity and throat irritation. Calamansi and lemon are highly acidic. When you have a cough, your throat is often already inflamed and irritated. The acidity of these fruits can further irritate the inflamed tissues, potentially leading to increased discomfort, a worsening cough, and even a burning sensation. This effect is more pronounced if the cough is accompanied by a sore throat. 2. Increased mucus production. Some individuals report increased mucus production after consuming citrus fruits. While not directly causing the cough, this increase in mucus can lead to more frequent coughing as the body attempts to clear the airways. This effect is more likely in those already prone to excess mucus production. 3. Individual sensitivities. People react differently to foods. Some individuals might have a higher sensitivity to the acidity of citrus fruits, experiencing a more pronounced negative reaction than others. This sensitivity can vary depending on the severity of the cough and the overall health of the individual. 4. Dehydration. While citrus fruits contain water, their high acidity can sometimes lead to dehydration if not balanced with sufficient water intake. Dehydration can thicken mucus, making it harder to cough up and potentially prolonging the cough. 5. Interaction with medications. In rare cases, the acidity of citrus fruits might interact negatively with certain medications used to treat coughs or other respiratory conditions. This is less common but should be considered, especially if you're taking prescription medications. 6. Lack of direct causation. It's crucial to understand that citrus fruits don't directly cause the cough. They are not inherently harmful, but their properties can exacerbate existing symptoms in susceptible individuals. The cough is caused by an underlying condition, and the citrus fruits simply worsen the discomfort associated with it. The effect of consuming plain citrus fruits on a severe cough is not a simple yes or no answer. While the acidity and potential for increased mucus production might aggravate symptoms for some, others may experience no negative effects. The best course of action is to listen to your body. If consuming calamansi or lemon seems to worsen your cough or throat irritation, it's best to avoid them during your illness. If you experience no negative effects, moderate consumption might be acceptable, but always ensure adequate hydration. As always, consulting a doctor for diagnosis and treatment of the underlying cause of your cough is crucial. The assertion that consuming seafood like squid, crabs, lobsters, prawns, and shrimps worsens a severe cough isn't universally supported by scientific evidence. but several factors could contribute to this perceived effect in certain individuals. It's crucial to understand that the relationship isn't a direct cause and effect, but rather a complex interplay of potential aggravating factors. 1. Allergic reactions. Seafood is a common allergen. Even a mild allergic reaction to shellfish can trigger inflammation in the respiratory system, leading to increased mucus production, a sore throat, and a worsening cough. This is particularly relevant if the cough is already present due to a respiratory infection or other condition. The allergic response can exacerbate the existing inflammation and potentially prolong the illness. 2. Histamine content. Many seafoods are relatively high in histamine. Histamine is a compound involved in allergic reactions and inflammation. While not directly causing coughs, elevated histamine levels in the body can contribute to increased inflammation, potentially worsening respiratory symptoms in those already experiencing a cough. This effect is likely more pronounced in individuals with pre-existing sensitivities or allergies. 3. Difficulty in digestion. Some types of seafood, especially those with tougher textures or less than ideal preparation, can be difficult to digest. When you're already dealing with a severe cough and potentially other symptoms like a sore throat, digestive issues can add further stress to the body. This can lead to fatigue, reduced immune function, and indirectly impact the cough severity and duration. 4. High purine content. Certain seafoods are relatively high in purines. While purines themselves don't directly cause coughs, they can contribute to inflammation in susceptible individuals. If the cough is related to an inflammatory condition, consuming purine-rich seafood might exacerbate the inflammation and worsen symptoms. However, this relationship isn't definitively established for coughs specifically. 5. Individual sensitivities and tolerances. People react to foods differently. What might be perfectly fine for one person could trigger a negative reaction in another. This is particularly true for seafood, given its allergenic potential. If you notice a worsening of your cough after consuming seafood, it's wise to avoid it, at least temporarily. 6. Traditional beliefs and cultural practices. In various cultures, there are traditional beliefs and practices surrounding the consumption of certain foods during illness. These practices, while not always based on rigorous scientific evidence, often reflect a cautious approach to nutrition during periods of ill health. The avoidance of seafood during a cough could stem from such traditional beliefs. 7. Contamination and foodborne illness. Although not directly related to the seafood itself, improperly handled or contaminated seafood can cause foodborne illnesses, which often lead to gastrointestinal symptoms and potentially respiratory complications, including a worsening cough. In summary, while there's no singular, definitive scientific reason why seafood consumption worsens a severe cough in everyone, several factors suggest potential indirect aggravation. These include allergic reactions, histamine content, digestive difficulties, high purine content in some species, individual sensitivities, and cultural beliefs. If consuming seafood seems to negatively impact your cough, it's prudent to avoid it until your symptoms improve. Consult a healthcare professional to diagnose the underlying cause of your cough and receive appropriate treatment. Post about foods to avoid during a severe cough, each with a slightly different tone. Option 1. Remember, listening to your body is key. If a food seems to worsen your cough, eliminate it from your diet until you're feeling better. Prioritize rest, hydration, and consult your doctor for proper diagnosis and treatment. Get well soon. Option 2. Dealing with a severe cough can be incredibly uncomfortable. We hope this guide helps you navigate food choices during your recovery. Remember, proper nutrition plays a vital role in healing, but it's always best to consult a healthcare professional for personalized advice. Wishing you a speedy recovery. Option 3. While this blog post highlights foods that may aggravate a severe cough, it's not a substitute for professional medical advice. The information provided is intended for general knowledge and should not be interpreted as a treatment plan. Consult your doctor for proper diagnosis and a tailored treatment strategy. Take care and focus on your well-being. Option 4. Nourish your body, not your cough. Choose wisely, rest well, and get better soon.